morning. Welcome to the presentation. Today's presentation really should be named Teaching Pediatricians How to Communicate with Their Young Parents and Patients. Social media, for better or worse, has become a very large part of our social fabric, and I think it's a pretty valuable tool to get out information to our families to help take care of their children. The next slide, you guys can follow along on your iPads, is just a little biography about me. I'll let you go ahead and read that. I studied at University of California, Irvine for my bachelor's, and then went to medical school at Eastern Virginia Medical School. Then did my pediatric training at the Naval Medical Center in San Diego. Ultimately, I'm now up in North Idaho in Coeur d'Alene, and I practice there. We're using Intergy by Sage for our electronic medical record system. That's who asked me to do this talk and talk about social media. That's just a picture of my family down on the bottom, down at the base of Mendenhall Glacier in Alaska. Had a vacation we were at this summer. Next slide. So this is a photo of our home, of our website. This is what they see when they first bring up the website. I did bring a few cards with our website on there. It's just www.cdapeds.com. We also advertise in our patient waiting area as well as in the exam rooms. We have little card holders to be able to pass out the cards for the website. Next slide. So just an overview of how we created our website. We had initially had looked outside to have someone create a website for us. Had discovered after just speaking with a few of our employees that there was some interest in-house for the web design. We had a gal who actually had done a web design class at one of the local junior colleges and expressed a lot of interest to us. So it was done with the managing partner who's been there for quite some time, and then approved by all the providers in the practice prior to launching the website. We update the website very frequently. About weekly, we have a disease of the week, and monthly, we have newsletters on pertinent topics, and we'll talk more about this on the next slide. We also update the website with recalls and alerts, such as the recent acetaminophen dosage changes. And we get about 1,200 hits per month to our website. So it's been, we think, pretty successful. So what's on our website? We have a disease of the week. That's listed there under the Parents Corner. We basically post a disease that we've been seeing most frequently in the clinic for the past week or so, such as RSV or influenza in the wintertime, strep in the spring or the fall, Coxsackie, injuries or bee stings in the summer, etc. And it's basically just a consensus of the pediatric providers as to what's been the most common. We also have books, and our list of books that our providers recommend to parents on various topics, such as what to expect the first year, caring for your baby and young children, birth to age 5, etc. It's also for patient education to include sites for vaccines, teen health, and also safety topics that are linked into our website, so parents can go and click onto the website, find the information they want, and it brings them to another website. We also have a patient portal, and if you go to the next slide, this is what our patient portal looks like. Overview, really, the patient portal is a way for us to communicate electronically with our patients. And we can get them visit summaries, which is part of meaningful use. Also they can send us information. They can get information about their children's vaccinations. And our goal is really to get 50% of our patients signed up with the portal. And I'll talk a little bit more about that on the next slide. Right now we only have about 11% signed up. And if you don't know already, meaningful use is going to start requiring that we give our patients a patient summary. It's similar to a little emergency room information sheet that you would get. And so if we can get patients to sign up for the portal, we'll get it electronically. We don't have to worry about getting them to it prior to leaving the office. Next is our Facebook. Excuse me. Okay. Getting ahead of myself here. Go to the next slide. Some of the things that they can do on the portal, and I kind of alluded to this already, they can request appointments, so they can electronically ask us, can I get in for an appointment today? Someone checks the portal messages very frequently, once in the morning, once in the afternoon, and they get back to them and schedule an appointment. So that kind of helps with phone tag or having to wait on hold or busy phone. They don't have to deal with that. They can also ask for a prescription refill on the portal. Again, it eliminates phone tag, and we're able to get them their request pretty quickly. They can pay their bill on this. They can also request referrals or ask billing questions. I think the big thing about the portal really is viewing a medical summary of your visit. It has patient instructions on there, what medications you're supposed to be on, what labs you need to go get done, and the information is all secure, and it's all within HIPAA secure, and they have to have their own individual account as far as email, and then they also get their own code to access their child's information. Next is our Facebook page. When we get a Facebook post, our assistant, hello? Okay, hello? So our assistant office manager is immediately alerted on his computer when we get a Facebook post. And so he always will review that post, make sure it's nothing objectionable, and if not, we go ahead and post that. So far, we haven't had any that we had to delete. Most people who are our friends actually like us, so it works out pretty well for us. Next is just an example of a Facebook post. We'll go ahead and post, we do every year free sports physicals for those children who aren't able to afford a sports physical. And then you can see the favorable Coeur d'Alene Pediatric rocks from one of our friends. So again, good advertising there. Next is just an example of a Twitter page and some posts there. I have to really say that our Twitter social media has not been as successful as our patient portal, our website, or Facebook. And then we just really target followers and send out just brief messages and updates about the practice. But again, Facebook and the website have been much more successful in communicating with our patients. Next is just an example of a tweet. So I don't know if you guys are familiar with Twitter and tweets and that kind of thing, but last, we do have a blog, and this is a relatively new thing that we just added. Again, one of the staff members, i.e. a physician, will come up with a topic, write a little post, and then we let the parents make comments. We do check the comments for accuracy, again, by our staff before we go ahead and post those to avoid misinformation or having negative posts on our blog. Last is just a copy of one of our monthly newsletters. Each month we pick a topic that would be salient to the time of year. This one is a sunscreen topic that we use for the summer months. We do a newsletter or two, and then we recycle the letter as per season. Just to summarize and wrap things up, our goal really is to drive traffic to our website in order to help educate and communicate with our patients in a meaningful fashion. And we have been, I think, pretty successful in using social media in our practice to communicate with our families. And I think really if you're going to be a successful practice, you really need to consider at least one form of social media to communicate with your patients. This is what your young patients are using right now. So, are there any questions?